I have specific training in pediatric neurosurgery and worked purely in pediatric neurosurgery for about 12 years, but I've also was the chairman of a large department where adults and children were treated together, and I ended up doing an awful lot of vascular neurosurgery. So I, over my career, have pretty much taken care of everything. But during my training, I realized that when I worked with children, I didn't feel like I was working at all. I loved being around children, I loved taking care of them. And what I'd always heard and believed was that if you love children, you should have them and not necessarily take care of them. But and it's difficult to do that sometimes, but it's important to remember that we don't cause these problems, we fix them. I think that most people in most endeavors don't necessarily want miracles from other people, but they want the very best possible care that they can get. And I reassure them that that's what they're going to get from me. So I think it's important to spend a certain amount of time trying to get them to what they believe is an adequate understanding of the problem. I think that most of the time that's possible as long as we don't slip into jargon. So I do my best, and I'm sure I fail sometimes, but I do my best to try and put things in terms that people understand. I decided to join NSPC for many reasons, but chief among them was the fact that I would be able to take care of both children and the children once they become adults. I don't necessarily think that there is a huge divide between the practice of pediatric neurosurgery and adult neurosurgery. Pediatric neurosurgery patients who survive beyond age 16 are still my patients. I suppose what might be helpful for people to know, yo hablo español, suficiente por tratar un paciente, no perfectamente en el mismo tiempo. Et je parle français, enfin en Haïti, on parle français normalement. Créole, c'est la langue de la plupart des peuples. But yeah, I speak French and Spanish pretty well, and German and Italian pretty passably, but that's just part of being European, I think. And together with a few of my colleagues, we have developed a long-term commitment to taking care of pediatric neurosurgery patients in Haiti. So I go down to Port-au-Prince quite a bit, and it's interesting. I see patients there that I operated on 4 or 5 years ago who are doing well. So you develop a very close relationship with your patients, and whether they should or they shouldn't, they tend to invest an awful lot of their hopes and fears in you. And that's the nature of being a doctor, because one can talk about neurosurgery and pediatric neurosurgery and this, that, and the other, but the job at its most basic form is to sit across the desk from somebody and offer them the reassurance of whatever knowledge that you have. So we're first and foremost doctors, and subsequently we use whatever special expertise that we have to take care of the problems with which we're presented.